Hello and welcome to the Health Occupations and Long-Term Care Subcommittee. We have 5 bills on our agenda today. So we're starting at 11. We are going to be done by 12 to make sure that members have time for a break for the afternoon hearings. And we're going to handle the two sunset extension bills first, so SB 125 and then SB 247. Then we will take up House Bill 652, which is the bill we've been working on for a couple of weeks now. And then finally, we'll take up the two dental bills, House Bill 1030 and House Bill 708. Just so the committee knows, and I'll mention this as we are about to take up those dental bills, we're going to discuss those only this week because we do have another bill in the same space that's coming over from the Senate that we haven't had the hearing on yet. So we will discuss 1030 and 708 this week, give the members the opportunity to ask whatever questions they have of the stakeholders, but we're going to withhold voting until next week when we have that Senate bill over because they're all really talking about similar issues. Okay, so with that, let's hear Senate Bill 125, chiropractic examiner sunset extension, which is a Tyler bill. Tyler, can you give us an update on this one?
Senate Bill 125 came with no amendments. The bill simply extends the sunset date for the State Board of Chiropractic Examiners by 10 years.
Sorry, I had to turn my light on because it automatically turns off all the time. This had a pretty easy hearing. I think we have Eva Schwartz here to answer any questions. It looks like Ashley Bagwell is here also. Do we have questions from the committee on this bill? If you have a question, go ahead and raise your hands in the panel. Otherwise, it seemed like a pretty...
Can I move the bill, Madam Chair?
By all means, moved and seconded. All right, do we have any further discussion? All in favor of the bill, say aye. Anyone opposed, go ahead and raise your hand in the sign. All right, good job. Passes unanimously. Way to go. Moving on to Senate Bill 125. Oh, I'm sorry, Senate Bill 247, which is the pediatric medical examiner sunset extension. I know we have Eva Schwartz here on that one. Tyler, want to give us a reminder on this one?
Senate Bill 247 would extend the sunset date for the State Board of Pediatric Medical Examiners by another 10 years.
Hi, Eva. Did you have something you wanted to add?
Thank you. I just wanted to thank everyone on the committee who has been just wonderful and wonderful throughout this very hard session. I appreciate it, and the board appreciates it. Thank you.
Thank you. We have a question from Delegate Cullison.
Well, actually, it's not a question. It's a comment that I wanted to congratulate the both of these boards as being so effective and having absolutely no issues raised in their evaluation. I've been here 10 years now, and rarely do I hear that. So you all are doing a great job, and I appreciate it. And I'd like to move the bill.
Thank you.
Thank you.
Excellent. Moved. And do we have a second on that?
Second.
Moved and seconded. Any further discussion on this one? I would just like to second what Delegate Cullison said as well. It's really very appreciated and noted. All in favor of the bill, say aye. And anyone who's opposed, put your hand up. I'm going to assume Delegate Cullison's hand is not really up. So with that, it passes unanimously. Thank you so much. All right. House Bill 652, Health Facilities, Residential Service Agencies, Guidance and Reporting. Lisa can give us a reminder of where we're at, but let me talk to the committee about this first. So we have talked about this bill for the last couple of weeks. If we need to talk about it more next week, we can do that too. I'm hoping that we don't, because just to give the committee a sense of what's coming up, we have the music therapy bill coming back, which I think needs an amendment. There's this other bill about the dental board that we were talking about. There's a social work temporary license bill that we're hearing today that might have some challenges we need to address. I'm not sure. The injectables bill that Delegate Lewis Young had has an amendment on it we need to consider. So we're going to be pretty busy next week. So it's my hope that we can come to agreement on what to do with this bill this week, which is the spirit in which I worked on what I hoped were some compromise amendments with the stakeholders, which are in your packet. And I have talked to a number of you about this. I didn't get a hold of all of you, but the amendments that Lisa's going to describe, I worked on with the stakeholders. I don't think it's fair to say that everyone is completely happy with them. I think that this has been a hard process for everybody involved, but I do think it is worth that there's a lot of folks on the committee with a huge interest in this issue. I don't think this is the last that we will be discussing this issue. The amendments before you have a report coming to us next session. It would be my intention to ask the chairman for a briefing on this issue in the fall when we get that report, so we can continue to dig in more deeply. So with that, Lisa, can you talk to us, remind us what the bill does, remind us what the amendments do, and then we can begin a discussion on this.
Okay, so the bill requires the Office of the Attorney General, in consultation with the Maryland Department of Health and the Maryland Department of Labor, to produce a guidance document concerning the application of employee protection laws to the employment of personal care aides by residential service agencies. The department's required to give this document out every year and updated every year. And the RSA is required to an employee at the RSA is required to certify that they have read and understood the document, and that that the RSA will comply with the relevant requirements of the labor and employment article. The reprint in your packet is it's similar to what you saw last week. It still clarifies that the certification is required as a condition of the initial license and every 3 years thereafter, and it restricts the reporting language. The new language in this reprint, it specifies that the certification will be completed on a form developed by MDH that will include a checkbox, and the RSAs will be required to indicate it through the checkbox whether they use personal care aides designated as independent contractors. The reprint also has 2 reports that are due back to the Finance and HGO committees by November 1st. The Maryland Department of Labor, in the first report, is required to report on strategies used to educate RSAs and workers on laws governing the classification of independent contractors. And the second report requires MDH to report on steps taken to bring the rates for personal care aides in line with the costs of delivery services. And that MDH had a report a few years back that kind of outlined some of the issues with this. And so that report is tied to what they reported on back then, so.
Okay, so basically, I think as Lisa just explained, what we tried to do with the amendments was, maintain a certain part. The original bill had 2 sections of reporting in it. One would help us determine who was using contractors. So this maintains that, but in a different form where there's just a checkbox on the original form. There's a checkbox on a form that says I'm using contractors. The second part of the reporting really dug into sort of the wages for those contractors. And instead of maintaining that, this has Department of Labor come and report to us about what's happening right now so that we can learn a little bit more. And also Department of Health come and talk to us about the rates. The rates have increased slightly in tied with the minimum wage, but not at the level that I think we were expecting and was directed by the legislature should be happening. So we need to figure out a little bit more about what's going on there. Again, this is a compromise. I think a lot of stakeholders are, feel as though they're giving about as much as they can give with this. I know that there are still some outstanding issues on the table. This is a difficult, it's a difficult conversation for our committee to be having. These issues are generally considered in the Economic Matters Committee in terms of classification, worker classification. So it's new for us. And so I think we want to take a cautious approach. We have heard testimony from what seems to be happening is an inter-industry conflict. We've heard testimony from folks who run RSAs who say nobody should be using contractors, who don't even believe it's legal for the use of contractors to be happening. We have heard testimony from other operators of RSAs who say we use contractors and that's what the people who work with us prefer because they're getting a higher wage way. I don't feel prepared to make I have my personal opinions on this, so it's really hard for me. But I think that a cautious approach, figuring out more, learning more, hearing more testimony on this. You know, at the original bill hearing, this was presented very differently from what we've been discussing in subcommittee. We haven't done a ton of outreach. We haven't talked to a single worker in this space. So that's why I wanted to proceed with this cautious approach, while at the same time setting us on a path to have a conversation that I think is warranted and really needs to happen. So that is my thought. Delegate Cullison has her hand up. Delegate Cullison.
Thank you, Madam Chair, and I want to thank you for your work on this. I mean, you just described how difficult this is, and I really appreciate it. So given that, I do not want to complicate anything, but I am wondering two things. In the study that MDH does around payment levels, will they include an contract versus employee so that we'll be able to see the differences? So is that part of the study? And the other part is anyone going to look at staff mobility? In either one of these studies, can we capture, because that's one of the issues that I think both David and Eric raised, is because of the way, and it's likely because of payment, but it's also because of, they just can't make a living. But how much mobility there is in these organizations, so that,
when you're saying mobility, do you mean turnover?
Yes, that's what I mean, turnover of staff. Because, it's so important for these vulnerable adults, seniors, to have some consistency. And I don't think that our current arrangement really supports that need for consistency. So I'm wondering if there's the possibility of gathering that data in either one of these reports without complicating things.
Yeah, I think those are really good questions. And I would like to bring the stakeholders into this conversation. I think in terms of staff turnover, my guess would be that would be not too difficult for MDH to figure out. And it's certainly something that we want to know about. I'm looking at the language, shall report on steps taken. So particularly in item 2, we're talking really specifically about bringing the rates in line. So increasing the rates. What we don't know, right, is how much of those, if we succeed in getting rate increases, as we got a minimal rate increase recently, is that being passed along to the workforce, either if employees or if they're contractors, right? We don't know that. That's kind of a black box right now. And I don't think, and we'll bring the industry and the other stakeholders in, and maybe they can help answer these questions. I don't think right now there's anyone tracking turnover across the board in terms of Medicaid funded hours. So let's see if anybody can answer those questions. I'm looking to see if there's anybody nodding, raising their hand, who thinks they can answer those questions. No, nobody knows the answer.
David's got his hand up.
Dana? Oh wait, Dana and David. Okay, let's hear from David and then we'll hear from Dana.
Thank you so much. And just to echo, I know this is a complicated issue, and I really appreciate the thoughtfulness with which the subcommittee is approaching these questions. Really grateful for it, given that I know for a lot of folks, these are new sort of terms and concepts sort of being thrown around. So thank you very much to all of you. With respect to turnover, that sort of gets at the core of the issue that the bill was trying to get at, which was this notion that poor job quality leads to greater turnover of the workforce. MDH has the data now. There would be no additional reporting necessary to determine turnover, and that's because with respect to Medicaid funded care only, because through that Medicaid funded care, each worker phones in and phones out of their shift using a unique passcode through it's called the ISAS system, ISAS. Anyway, so what MDH could already do is an analysis of its existing ISAS data to see which workers are clocking in for work through which RSA for which consumer, and then could see the turnover rate for that very large, which is again, more than half of the care provided in Maryland is funded by Medicaid. You could get a great sense of what the turnover is for that subsection of the workforce without asking RSAs to report any additional information. So I personally think that's a great idea to include there.
Excellent. Dana, did you have something to add?
Sure. And what I would just add to is to remember that the study back in 2018 looked at the overall cost to provide the care versus the reimbursement, which goes to the entire program cost, the cost for administrative issues, but also to pay your RN. All of the personal care aides must be provided oversight by the RN. So that money goes to the RN wages as well. And I will tell you, during this pandemic, the wages that had to be paid were all increased just in order to maintain staff. But I think what the issue with the funding is the fact that not only did this committee require that report, which came back and showed the deficiencies between the two, but then you continued with requiring through the budget a detailed 5-year plan for narrowing that gap. And that never occurred because the plan that came back basically said we just need to get more information. And then that never has happened. But a lot of that budget drives this issue. But I just also want to say, I'm a little bit confused because the whole bill in the beginning was about creating a guidance document to provide more information to RSAs regarding the proper classification of individuals who work with them. And now it seems that the whole purpose is regarding the pay, which is a different bill hearing than what I thought we had. So I just wanted to kind of point that out too.
So before we go to Delegate Charles's question, let me just get drilled down with you, Dana, on the issue of turnover. I agree with you completely on sort of point number 2, that we need to take a big picture look at what has not happened with that 5-year plan, and that's going to help this industry for sure. And I think everybody in the committee probably agrees with that. In terms of Delegate Cullison's specific question about looking at turnover within the industry, would you be, since MDH does evidently have that data at the ready, would you be opposed to us specifically asking for that to be included in a report?
No, I think you could say including turnover rates if they,
Okay.
if they have that
Okay.
easily available.
Okay. Thank you, Dana. Delegate Charles.
Thanks, Madam Chair. This question is for you, David. You had mentioned about the clocking in for some of the RSNs. Is there a way to separate out W-2 employees clocking in? Because as a 1099 employee, you shouldn't be clocking in because you're an actual contractor. There should be some level of submitting invoices or something. Is there a way to make sure we track that?
Well, that's correct. Generally speaking, 1099 workers are paid by the job and not by the hour, which isn't the case in this field. But there isn't, and so you have all workers, whether they've been classified as 1099 contractors or W-2 employees, using the same clock in, clock out system, and being paid by the hour.
Yeah, I
So
think that creates the larger problem and the issue that folks are bringing up. As a 1099 worker, you shouldn't fall under the same classifications as a W-2 worker. You're an actual contractor versus an employee, so you don't follow the same guidelines as a W-2 employee.
That's the core of the issue here. I mean, that's the the finger on the nose here of what we're trying to fix. And just the bill originally it was guidance, reporting, and enforcement. So the enforcement was gone, and then it was guidance and reporting. And to explain the issue, we focused on the guidance, but the reporting is a key part of educating policymakers about what's going on. And we agree that rates should be increased, but our only position is I think it's appropriate to look at not just industry's representations of how much they're paying out. We have clients who have been paid the same amount regardless of minimum wage increases and have not gotten raises during the pandemic. So I think it's just appropriate for the state to ask how its money is being spent when you're talking about a vulnerable workforce and a vulnerable consumer community. So that was the purpose of the reporting, is just to provide the information to policymakers when you're going about looking at appropriate rate increases and appropriate ways of carrying out those rate increases to make sure that they're actually being used in the way that you intend them to. So that was just the idea of it. There was no hiding the ball. The information was in the bill from the beginning, but that was the purpose of it, just to sort of answer that point.
Okay, and before we go to Delegate Saab's question, I just want to point out for Delegate Charles, because I think he, he accurately pointed some concerns out, that the November 1st report that we would have before us would be, and again, I would ask the chairman for a briefing on this, have the Department of Labor come in front of us and explain to us what they're doing in terms of education of employees and also determining whether a worker is an independent contractor or an employee. So we will be getting more information. I think we want the Department of Labor to take a closer look at this, and we're making that clear with this language. Delegate Saab.
Thank you, Madam Chairman. I mean, I think we're getting a little bit too into the weeds whether 1099 clock ends, and then 1099 should clock in just W-2. The difference between 1099 and W-2 employees are how they're treated, and the tax, whether they take payroll tax out and other things. So just to answer the question, I mean, clocking in, clocking out, it's irrelevant. And I think also if you're going to study like turnover, I mean, we're also getting into the business of small business or private businesses. And the turnover doesn't always mean because of classification. I mean, people turn over because, like I mentioned before, this is a hard job. It's not an easy job, and people can only do it for so many years. And sometimes you can't even pay many of us enough to even take that job. So I guess if you're going to study turnover, I don't understand if the turnover result or reports come back, how's that going to make us more informed to create policy? I'm still confused. I mean, I think if you want to guidance, let people know that this is the difference. I don't see any problem with that. But beyond that, I think this bill just getting a little bit too into the weeds of private businesses.
Okay, Delegate Krebs.
Thank you. And I'm trying to look back at my notes because it's changed a lot. But the first question I always ask is, what's the problem we're trying to solve? And during the testimony, we said that there are lots of jobs available, lots of choices, and 90% want to do independent contractor and are clearly explained the benefits. So we never really had individuals come from these independent contractor, the people, not the agencies, to say, hey, we don't want to be like this. So the question is it a problem that, I mean, it seems like there's lots of jobs out there because there's clearly laws with the Department of Labor of what's an independent contractor today. And I used to be on Economic Matters. I'm an accountant. It's clear what an independent contractor is. So maybe, whether we get that information out or not. So that's the question. What is the real problem we're trying to solve? And are these people demanding, they want to be employees? And some of them, I think what I understood is they have two jobs. They might have a job in one place and then it might be an employee in one place and do on the side in a separate place, and they're an independent contractor. So that, again, I get back to what are we trying to solve here? And then the second one, Maryland Department of Health, I don't know if anybody's on for that. They basically say they don't have the resources to implement the bill if passed, and that's the original bill. So I'd like to hear from them. And then the last thing is on Medicaid, do we require any other providers under Medicaid to have to report their hourly rates under Medicaid? And maybe
well, this you can answer that, but this would strike that part. The hourly rates are not included with this amendment that we're discussing right now.
Wait, so the reprint, the last line on page 5 on the reprint says each residential service agency shall report the hourly pay rate of the personal care. So this reprint is not the final reprint.
Wait, hold on. You're on page 5.
Very last sentence, line 15.
On page 5.
Page 5 of 5, line 15.
I think you might be looking at a different reprint.
Well,
On page 5 and line 15
I have
says
so many
describes a
reprints.
specific reference. Yeah, we struck the reporting of with this new reprint. We struck the reporting of the wages exactly for the reason that you're stating.
Okay, so all right, then I don't have the
reporting
most. I have a reprint from. Okay, maybe I don't have the most current reprint. Let me look at that while you're.
Okay, yeah, Lisa sent it out about an hour ago.
Oh, okay, I see. I got a different reprint I'm looking at. So that's struck. So can you go back to, is anybody here from Department of Health?
I don't think we have anyone here. Sharon, let me know if I'm wrong, but I don't think we do. I know that Dave Rodwin has his hand up. Are you able to answer Delegate Krebs' question about whether Department of Health is okay with this bill as amended? Because I know it's changed a lot since it was introduced.
Not that aspect of her question, no.
No, only they just said they have so much going on with COVID, they just didn't have the bandwidth to do it this year. And I know we've asked them to do a lot of other things this year as well. And you want to make sure they really can do what we're asking them. But I guess we can find that out offline.
Okay, Delegate Cullison.
I just wanted to respond to Delegate Saab's question in terms of why I was interested in turnover. And I think it's tied directly to rate setting. It's not tied to whether they're consultants or contractors or employees. It's if we're going to be looking at rates, I think we should be looking at the turnover in order to make sure that it's not the rates that are causing a high mobility of staff, high turnover of staff in a very vulnerable setting. So it's not too deep in the weeds, Delegate. It's just, that was the reason I was asking for it.
I think that's a really important distinction because one of the challenges with this bill is that we've been trying to step back and look at a big picture look and not necessarily be, not have all of this work result in just the conversation about whether people should be contractors or employees or both, but rather for this entire workforce, what can we do to strengthen it and how does that impact quality of care? Is that fair? Yeah. Okay, so any other comments from any other members or questions from any other members on this? Looks like Delegate Bandari.
Yeah, thank you, Madam Chair. I've not read the new amendment, but what I believe is the major question is how did we arrive at this space? That is very, very important. And with this new amendment, will the problem be solved? Because everywhere the knowledge piece is important. Okay, the reporting requirement is an education piece, and if the state can gather as full data as possible, and we can find how extensive the problem may be, and we the additional measure. I don't disagree with the amendment, but at some point, it seems to me that when the more questions are being asked and we are debating on this bill, I'm kind of curious to know what's going on with that misclassification, or I mean that really is more kind of worrisome, and I'm wondering on that. Okay, that's my comment rather than the question.
I think that's a really good comment, and I think you're not the only member of the committee that is very concerned about the issue of classification that's been raised in this bill. My hope is that the guidance document will be helpful. The checkbox will be helpful. It's not necessarily 100% of what the advocates wanted coming in, but it's moving us in the right direction. And presumably having a briefing and a report from the Department of Health and especially the Department of Labor on this issue will also move us towards a direction of a better understanding in terms of whether there's we know that there's different classifications happening. It's unclear right now if it's misclassification. I think there's a division in the committee on interpreting that. But if it is misclassification, we want to make sure that that's not happening in the future, right? So I think that I see Delegate Krebs's hand up, but that's certainly the intent of the amendments. Delegate Krebs.
Yeah, thank you. And about the checkbox, I'm reading it now. There might be, and I'm not sure Dan might have answers, there might be some RSAs that have some employees, some independent contractors. And one reason people like to be independent contractors, I know that myself, I was one, you want flexibility. You don't want to work every day. You're a mom, you have kids home. You want the flexibility to choose when you want to work. So I guess the question on this form, are some of those RSAs hybrid? And would this account for that? And because again, I think a lot of people like the flexibility of being an independent contractor versus an employee. But how do we drill down on that and make sure it's not just by choice? Because from my perspective, it was always my choice. I wanted to be an independent contractor because I wanted to control my hours and my time and when I could work. So on this form, will it be, do some have both or have a hybrid model?
I would imagine, I mean, this is just me, I don't have any of that data, but I would imagine that some probably do have a hybrid model. Some may use just 1099s, as you heard last week from the RSA owner, Alex. He just uses 1099s. Some just use W-2s, some may use a hybrid. I mean, I think that is information that we can, I don't think anybody has that now. I think that might be information for, and I don't think it needs to go into a bill, but if you do a briefing I think that that is information that we can try to determine during the interim, but I would have to say that there are some that, use that hybrid. And I do agree with you. There are advantages for individuals who do want to be an independent contractor. So I also think we need to tread softly so that we don't do something that actually disadvantages the industry for those who still want to be an independent contractor. And there are those who do.
And believe me, in this environment now with COVID, people want to have flexibility because they have other competing interests. Their kids are home. So keep that in mind, because I've always been an independent contractor. I never wanted to be a W-2 because I wanted flexibility. And I'm not in the healthcare field, but I'm just saying there are advantages to people. That's why they do it. It's not always about the wages and the compensation. It's about the control of your schedule and being able to work in different places. You might work at 2 different agencies and have 2 different groups you work for. So it'd be nice to hear why people want and choose that. I think there's enough jobs to go around.
And I will say now, especially with COVID, that just trying to find a workforce for this industry has been very difficult, and most are hiring. So frankly, there is the ability to go to different agencies. So if you work, if one agency just wants you to be an independent contractor and you don't want that, then you can go to another one and be a W-2. You have that choice too. And there is enough availability in the workforce right now to give you that choice.
All right, it looks like Dave Rodwin has something else to add. Dave?
Oh, thank you. Yeah, so just on that point of flexibility. So we heard from 2 RSA owners who mentioned that they have their whole workforce as W-2 employees, and that they are able to maintain that flexibility by just having the workers be, it's called PRN, just having them work as needed. There's no harm to flexibility in classifying workers as independent contractors, as employees. And I agree with Dana that there are agencies that have sort of both employees and independent contractors in their workforce. Sometimes what they'll do is they'll tell the workers, we'll give you an extra $1, $2 an hour if you agree to be classified as an independent contractor. One of the big issues is that an individual does not have the ability to agree to be an independent contractor. It's a legal question. And so simply, sort of asking to be one doesn't affect the inquiry. And a lot of workers do, in fact, say, oh, I'm going to take the extra $2 an hour because I've got rent coming up at the end of the month. And they're not thinking about the tax bill at the end of the year, which is going to be much higher as a supposedly self-employed individual. And they're not thinking about the possibility that they'll be injured and lose out on workers' comp because of their independent contractor classification. They're just thinking, how do I pay for my bills right now? So that's one of the big issues in this space. And the purpose of the bill is just, we want to improve. We do have a lot of these jobs vacant, and that's because they're bad jobs and no one wants to do them. And if you make them better jobs, people will come into the space like they would in any field. It's not rocket science. It's just, you improve job quality, you make them better jobs, you bring them into the social safety net. We'll see these jobs getting filled real quick. And that's part of the purpose of the bill, sort of broadly speaking. But I'll be quiet now.
Okay, before we hear from Delegate Mandari, who will have the last bite on this apple, because we do need to do the dental bills this week, I will just ask Delegate Krebs, because she raised a question about the Department of Health. If you need time to figure out if you're comfortable with these amendments, we can bring this bill back next week. We don't have a motion on the amendments yet. Or we could discuss, we could move the amendments with the modification that Delegate Cullison suggested, adding information on turnover rates. But since Delegate Krebs raised the concern about MDH, I just really want to come back to her and get her opinion on that.
Well, I'd like to let them see we can move the amendments. I think the bill has gotten better and less owner. I think I was looking at the Attorney General's, and I was a little irritated because they basically already have decided that a certain thing is wrong. And I think that's the whole purpose of this. They've already made the assumptions that many of the employees of RSAs, notably personal care aides, are misclassified as independent contractors. And I think they've already made up their judgment before we even have looked at it. Why are they being classified that way? So that's frustrating that I think some of the proponents are already making judgment without the report. That's why I think the report is important. Why are some of these people doing it? Why do they want it? But I would like, we can adopt the amendments if you choose with that, with Delegate Collison's suggestion. And then if you would let me go back and like talk to them and say, can you do this? Can you get this information together? And I'll get more time. I was reading the wrong reprint, so that's my fault.
Okay, so let's go ahead and move the amendments so that we can keep the bill somewhat moving. Thank you. The bill amendments have been seconded. Any further discussion on the amendments? Is Delegate Bandari, is your question on the amendments, or we can come back to it as soon as we're done adopting the amendments? Okay.
Later.
For the amendments, say aye. Anyone who's
Aye.
opposed, raise your hand, aside from Delegate Bandari, who I know has a question or comment. Okay, so the amendments are adopted unanimously. Delegate Bandari.
Yeah, Madam Chair, to be honest with you, this bill confused me so much. We started with guidance, classification, and pay rates, and this title is so fanciful and very cosmetic. The title made me confused as well. So it seems that we are trying to do something else. I think that might be the bill for next year. So it seems more like it is the ways problem, the labor's problem, the workers' problem, how much they are being paid. But the intention, because of the cosmetic title, made me confusion. Just the comment, okay? So the more confusion I started having, like the bill, what's going on, like the ABC test, IRS, labor law, and all type of thing we discussed. But still, I think we did not hit on the head what was the problem. Listening to David, Dana, and thank you so much for helping us and educating us on these issues. Thank you.
Absolutely. So, and I think you're right. There will probably be a bill next year and in future. This is not an issue that we're going to be able to solve with this one bill. Do members want to? I'm just thinking of we can come back to this a week from now as the next time we're meeting. Is that Delegate Krebs? Is that your preference, or should we vote on the bill and then we can see if we can find out before we?
I mean, if you don't mind, I'd like to have Department of Health on board with it. I wish they were here.
I know. Okay, so we'll hold it until the next meeting, but as amended, and then we will. We still have plenty of time to move it out in time, even after next week. Okay. Does everyone feel comfortable with that plan? Looks like Eric has something to add. Eric.
Thank you, Madam Chair. Just a real brief comment, just to say thank you to the committee for their thoughtfulness in which they've approached this issue. There have been a lot of different opinions we've heard. The Senate hearing was pretty quick and unanimous, and this hearing, we've heard from a lot of members in past weeks who were willing to accept the Senate bill as written. We've heard from a wider range of opinions, but the end result is that we're wrestling with an industry, and I should say it's an industry of which I think the latest number I heard, only about 35% accept Medicaid. So this is not just a rate setting issue, but it is an industry that is caring for Maryland seniors. So when we think, and one of the initial questions as to why this has moved from Economic Matters to HGO, it's really the fact that they're caring for Maryland seniors. We're trying to get, as the Maryland seniors, the number of them increases, we're trying to get a sustained, quality, good workforce. So the job quality, the issue of classification, the issue of their salary are so vitally essential. So I just want to thank the committee for their thoughtfulness, again, in which they've dealt with it. Maryland seniors benefit from it, and I just really appreciate the conversation on it.
Okay, thank you very much. And thanks to all the stakeholders for working so hard with us on this. It has been a lot of effort on the parts of a lot of people. So we will hopefully get some clarification from MDH and move forward, whether they, we'll take a vote next week, no matter what, no matter what we hear from MDH, or if we hear nothing from them, which has been known to happen as well. Let's talk about the dental bills next. And again, reminding the committee that we have a hearing on another bill that passed out of the Senate that is a work group bill. So we haven't had that hearing yet. So we'll have that in subcommittee presumably next week as well. Let's talk first about Delegate Saab's bill, which is House Bill 1030, State Board of Dental Examiners. We have 20 minutes left. So, we'll talk about Delegate Saab's bill first, but at the point at which the conversation may seem to overlap into Delegate Krebs' bill, we can bring that into the conversation as well. So House Bill 1030, I think, is Tyler.
Hello again, House Bill 1030, State Board of Dental Examiners Membership, Nomination, and Appointment Process. A quick summary of this: the bill will alter how nominations and the appointment process works for the State Board of Dental Examiners, removing that the board require nominations and a balloting process from each licensed dentist and dental hygienist for vacancies, and instead it would just directly be by government appointment from a specified list within the bill.
Okay, and I think I'll just refresh the memory of the subcommittee who maybe doesn't live and breathe this as obsessively as I do. This we had an interesting hearing on. There was a little bit of confusion around the fact pattern related to the bill. So I feel like we could use some time with the stakeholders on this bill to really figure out sort of what we think the challenge, the problem that the bill is trying to address is, what we think that problem is. So with that, I'll see if Delegate Saab has anything to add, and then we can talk to some stakeholders. Delegate Saab.
Thank you, Madam Chairman. I think I'm going to defer any of my time to have to probably Jerry or Haley Evans. I think that what the Senate bill, I guess, did or will do, it's a study, it's a task force to tell us what we already know. I mean, I think there are good dentists, there are bad dentists, and it's just, there's good and bad in every industry. The problem is that the board has failed to protect dentists and bad dentists. So I don't think, the study is a task force to just let us know what we already know. And I think there has been a lot of issues, and even though there has been some, explanation, but there's a lot of, I guess, lack of a better word, behind the door deals that led to a lot of issues. So I don't know if Haley wants to add something.
Yeah, let's hear from Haley and Gary if they have anything to say, sort of picture on this discussion, with the understanding that we're going to discuss this bill, the Krebs bill, and also the Senate bill next week.
Thank you. Thank you, Madam Chair. And thank you, committee members, for the time to talk about these bills. We believe the hearing made it crystal clear that there are significant problems with both the appointment process and the administration of justice by this board. By your own legislative auditors, they uncovered a $300,000 no bid contract given out against all Maryland procurement law. And again, this was just released a month ago. We have a colleague, Danielle Varanian, who's going to talk a little bit more about it, but understand this, members, this is the only health board that has this election. They have an election administered by the board and the Dental Society where a slate of candidates is preferred. It's a good old boy system that leaves a lot of people out. And why do we need an election when no other health board has an election? Let's have this name submitted to the governor and let the governor pick the names that he or she believes are best. So with that, I'd love if you would allow Danielle to speak on this as well, please.
Sure, absolutely. Danielle?
Good morning, delegates. Danielle Varanian. I'm an attorney that represents healthcare providers, including dentists. And to put it plainly, the way that this election functions is really a dysfunction. As Jerry said, this is the only health occupations board that has an election system instead of a true appointment process. And delegates, as evidenced by the last round of appointments, this is a dental board that can't even get it right when the statute is crystal clear about what the requirements are for who needs to be appointed. In the last round of appointments, a dental hygienist was appointed that hasn't been actively practicing in the state for 3 years. the statute under health occupations 4202D specifically requires as one of the requirements for a hygienist that they be practicing actively in the state for 3 years. So even the simple administrative task of making sure that the names that are being submitted to the governor after the election are appropriate names that meet the statutory requirements, they're not even getting that right. And as Jerry said, they're submitting all of the names to the governor. This election process is not necessary. This should mirror what the Board of Physicians and all of the other health occupations boards do, and not have it be an election process, have it be an appointment process. I'm sorry, were you going to say something, Delegate?
No. Are you done? I just wanted to make sure we hear from the, okay, so do we have someone here from the dental board? I'm just looking through to see who's here. Is there anyone from the dental board here? I see Dan Doherty here.
Ed Morris.
Oh, hi. Come on. So please respond.
I have some testimony that I want to offer. I can't go point by point on what the comments that were made, but the board has concerns about the bill, and particularly with the politicization of the board itself. There's no requirement that the candidate be in good standing, and no vetting process is there. The board fears that those who have been subject to the board orders may harbor a vendetta against the board or its members, and that could cloud their judgment. The board is more concerned, or is concerned, about the large, well-funded organizations using this structure to influence and politicize the appointment process. Professional trade groups should not influence board appointments. Board members should be beholden to no one but the citizens of Maryland. The board is particularly concerned about false accusations and improprieties relating to the board selection made by proponents of the bill. For example, in testimony, they said, quote, the board determines who the candidates will be sent to the governor's office, which is not true. The board controls who gets appointed, which is not true. The board cherry picks, and the board who the board likes gets submitted. These are all accusations that are false, and I would argue that they are conspiracy theories, or at least it sounds good to those people that make the argument. The board, according to Board President Jim Goldsmith, in the 13 years the board has administered the election, has never removed a candidate's name before reporting to the governor, nor has the board denied anyone a fair election. The governor appoints board members from a list of candidates and is not constrained to select candidates who have the most votes. But for these reasons, we have considerable concern about this bill.
Okay, I see a question already from Delegate Charles. But before we get to questions from the committee, I want to make sure that everybody who took time out of their day here to talk on this bill has a chance to do that.
This is Leslie Grant.
Yes.
I'm also from the dental board, and I would love to speak. I do not have testimony. I was prepared to answer questions. And I would like to state that I'm a general dentist. I serve on the dental board. I was appointed in 2018, but I'm also licensed as a speech and language pathologist here in Maryland. So I do have 2 licenses and am somewhat familiar with the operations and differences between 2 boards. I would like to say, in response to some of the statements, that they are not accurate. The board does not make appointments. The governor makes the appointments of dentists, hygienists, and the consumer board members. The board does conduct an election. That process was changed about 10 years ago, around 2008 or 2009. Prior to that, the elections were held by 2 societies alternating within the state, 2 dental societies. So the movement to the board actually hosting the elections is actually more in line with what the department having control over the names that are submitted to the governor. The elections are merely that. It is a collection of information to make certain that the individuals who are applying for the board are actually licensees in good standing. And I would like to point out that the board is offering amendments. It's not opposed to the bill, is offering amendments. And that is one of the statements that the board has requested, that the candidates or nominees be dentists and dental hygienists who are in good standing, whose licenses are in good standing. So those are the major points that I wanted to address. The board does not appoint. The board makes recommendations based on the election and sends all names of every candidate to the governor's office or to the appointment secretary to convey to the governor for appointment.
Thank you for that. Let's hear the question from Delegate Charles.
Thank you, Madam Chair. You know, I heard something from Mr. Morris, and I had some conversations with Jerry, and it sounds a little counter to what I've heard. And so, Jerry, can you kind of elaborate on what happened the first time Dr. Thomas, the dentist who came in and gave committee testimony, can you let us know what happened with her when she applied to be on the dental board?
Yes, Delegate. We understand that even though Dr. Thomas was on the list and sent over to the governor's office, and again, in violation of the law, the privacy of Dr. Thomas, calls were made to the governor's office asking that she be checked, that she be eliminated off the list. And I know for a fact that that happened. So when Dr. Grant says that the board has no control, that's simply not true. They backdoor information to the governor's office about who they want and who they don't want. Imagine judges that could pick other judges to serve in a court situation. That's what we have here. These people serve as judges and rule on the very livelihood of these dentists. Why should they be able to pick their friends to be on this board? MedChi does very well by having no involvement in the selection of doctors for the medical board. If it works for them, why can't it work for the dentists?
Okay, do we have any more questions from members? I see Leslie Grant's hand up. Leslie, go ahead.
Thank you very much. I'm sorry, I don't recall the name of the gentleman who was speaking, whom I don't believe I have ever met. I do not appreciate my veracity being called into question. So I will state that straight out. I would like evidence. I would like to know, he said he's aware of calls being made. I am stating this is untrue. We submit names. We are very busy as board members trying to fulfill our mission to protect the public and to ensure quality dental care in the state of Maryland, and that appropriate individuals are licensed. This takes a lot of hard work and time, and we are volunteers essentially for the state trying to do our best to fulfill the mission. I have not misled you in any way. I take offense at a statement being made based on phone calls or that he has heard about. I would like to see the evidence. You have the information that we sent Dr. Thomas's name to the appointment secretary at the hearing previously. If you may recall, that was stated otherwise by those parties. We did send the information to the appointment secretary, and we stand by this.
Okay, we have to have Delegate Bandari, Delegate Lewis, and then Delegate Krebs. And then someone else speaking up. Did someone want to respond to that?
It was me, Delegate Kelly, Danielle Varanian.
Go ahead.
I just wanted to make one point that if all of the names are submitted to the governor, the election serves no purpose. If every candidate who fills out an application and a petition to be appointed to the board has their name submitted to the governor, then the election means nothing.
Thank you for that. So let's hear Delegate Bandari's question.
Yeah, thank you, Madam Chair. I don't think here is the debate between whether election process is better or appointment process, right? I don't hear that conversation, definitely. But the question is to Morris. So do you know how ideas of your member are traveling, and is that true that the ideas of the member are not traveling out of the privileged spaces, that you guys control certain things and they are not happy? Why do you think that there is a lot of convolution and confusion around your elections? Why, like everybody's questioning your elections?
I'm not aware that everybody is questioning the elections, except the people that don't like them.
Why do you think it is so?
Let me make a point. When any election, somebody might claim, well, I never received a ballot, or my ballot wasn't counted. Every effort is made that everyone is treated fairly. Everybody gets a ballot. Every ballot that we receive back is counted. There are witnesses, and everybody, it's above board. If somebody says, well, I didn't get a ballot and my ballot wasn't counted, if we make every effort that everyone receives that information and can do it properly.
Madam Chair, if I may, can you please respond to Daniel's question? If we held the elections and there are the winners and you send every name to the governors, and what is the purpose of having elections if it does not have a value in that character and that commitment?
Well, one purpose is that some members within the state are better known than others, and I'm speaking from the standpoint of a board member, that people that are voted upon were people that vote for them. They're voting for people who have good character, have good judgment, are not biased, and they're going to do a good job, and they're going to be fair both to the dentist and to the public. And I think everybody that is voting in this process realizes that, and therefore their opinion in that sense is worthwhile. It's not one to be discounted, but it's a useful. It doesn't determine who's going to be elected. The governor can pick anyone he wants. He can pick people that aren't on the list. But I think the information, I guess the validation from members of the dental community should have carry some weight in terms of the integrity and character of the nominees.
Thank you.
Delegate Lewis.
Thank you, Madam Chair. Hope you guys can hear me. I'm using my phone. Thank you, everyone, for the discussion. I'm curious, whoever can answer this question, I'm curious as to the origins of the board election process on the dental board. What are the origins, the historical source of that difference? Why does the dental board operate differently than the medical, nursing, and other professional health boards?
It looks like Charles Doring may be raising his hand because he can answer that. Is that right?
I'm sorry. Yes, Charles Doring. I will defer to Dan because he knows the history better, and then I can follow up after that if possible.
Sure, Dan.
Thank you, Madam Chair. The law, it used to be that, as was pointed out earlier, that an election was held, conducted with the two dental associations in Maryland, the Maryland Dental Society and the Maryland State Dental Association, and they alternated who hosted. And there was an election conducted, and the results of those elections were then submitted to the governor. Pursuant to legislation that was sponsored by then Delegate Shirley Nathan Pulliam, this whole thing was changed. So this is part of Delegate/Senator Pulliam's bill of about 13 years ago. This was not initiated by the board, and it was not initiated by the associations. The second thing I would like to point out is under House Bill 1030, you get nominees from any qualifying dental association or for anyone who has a petition of at least 25 people. All the names that are nominated go to the governor under the bill, no different than what the board is doing under the current system. I would also like to point out that we have gone from the hearing in which the contention was that the witnesses were not submitted to the governor to now, well, they were submitted to the governor, but somebody made a phone call. And I think we have a factual problem there. And finally, I would like to say that there is no board that I have been able to find under the Maryland Health Occupations article that nominate similar to 1030. And there are a number of them: chiropractic, physical therapy, occupational therapists, psychologists, podiatrists, where the nominees come from an election by the association and submitted to the governor. So this is a process that's trying to take the advocacy associations out of it and having it conducted by the board. And that was Delegate Shirley Nathan Pulliam intent at the time.
Thank you, sir. Madam Chair, if I may follow up.
Sure.
So I appreciate that answer again. Thank you. I'm just wondering if this whole conversation about the dental board's practices regarding board nominations, board elections, board selections, it's a little ahistorical. It just so happens my father was a physician who graduated from a Harry Medical College, a Black medical college, because no white universities would accept Black. My uncle, my father's brother, was a dentist who graduated from Howard Dental School, because at the time there were no white schools that would accept Black dental aspects. And when my father and uncle came out of their medical and dental training, they were not allowed to join the American Medical Association or the American Dental Association. We had to have our own African American professional associations and opportunities for leadership and growth, because white organizations wouldn't allow us. And I'm just feeling a little sense, being a little off balance here, this kind of ahistorical conversation about how the dental board ended up the way it is. I would like to understand if there's some sort of historical forces driving this unusual selection of dental board members. If it results in some kind of disparate participation of dentists in Maryland, we need to look closely at that. And we need to, and then I ask myself, of all the members of the legislature, why Shirley Nathan Pulliam thought this was an issue important enough to give her attention to for years. And having had the good fortune to know the senator, I am aware of her commitment to justice and fairness in the health professions. And I'm just wondering if we should strive as members of this committee to identify historical practices that have undermined fairness and participation and representation in the dental field and in dental leadership in our state. And if this bill gives us an opportunity to do that. Thank you, Madam Chair. I'll end there.
No, thank you. I really appreciate your comments. And I will say that I have heard from Senator Nathan Pulliam on this bill and on the House Bill 708, Delegate Krebs's bill in particular. I know she's watching this and she still has concerns. So I'm glad that you brought that into the conversation. Let's hear from Delegate Krebs.
Thank you. I just wanted to straighten out, Danielle, you started off talking about one of the dental hygienists that wasn't necessarily qualified, wasn't in the state of Maryland. Does the dental board put those names forward as well, or does that come through the dental hygienist? How does that work and how does that get resolved?
Yes, Delegate Krebs. The dental board puts forth the names of the hygienists as well as the dentists. And it's the dental board that gets the packet of information, including the CV of the hygienists and dentists, to make a determination if they meet the qualifications. And in this case, they didn't. And I do want to take the opportunity to respond to a few things that Mr. Doherty said. With respect to Dr. Thomas's testimony about her name not being submitted, Mr. Doherty said that we have a factual problem. What we really have a problem with is due process. It's not a factual problem. Although Dr. Thomas misspoke about her name not being put forward, the effect of the dental board calling and putting a black check mark next to her name was to remove her name from consideration. And that was a violation of her due process rights. And the other thing that Mr. Doherty indicated about this bill, House Bill 1030, is that he couldn't find any other health occupations boards that have this same type of appointment process. This bill is modeled after the Board of Physicians appointment process. So I just want to make that clear that this bill is modeled after the Board of Physicians appointment process.
And Madam Chair, I don't know if it's appropriate if someone from the board can address why someone's name got put forward, a dental hygienist that wasn't qualified, or do they disagree with what was just said? I mean, it's.
Yeah, I think that's a good question. Is there somebody who can answer that? Does Edwin Morris want to answer that, or Dr. Grant?
I can briefly state that I am not aware of anyone's name being put forth who is not qualified or whose license is not in good standing. This is the first I've heard. As with your hearing previously on February 24th, when the protracted misstatements were made over a lengthy period of time, stating that someone's name was not submitted when indeed it was. And I believe you all received a letter and follow-up from the board showing that evidence. And I would again like to say, I do not appreciate hearing that someone heard about a phone call that someone else made and that the board has put a black check against someone's name. That is rumor and innuendo. It is not fact, and it is untrue.
Well, let's see if, since we're clearly coming back to this bill next week, if someone from the dental board can get an answer to Delegate Krebs' question as to if that happened, or if not, clarify for us. Delegate Saab.
Actually, I took my hand down. Danielle, my point that I was gonna.
Okay, perfect. So everybody knows that we're 8 minutes over schedule, and I apologize for that, but I didn't want to interrupt what I thought was an important discussion. I would really like it if Tyler could just remind us what Delegate Krebs's bill does. We won't discuss it, but at least the committee can have it in mind as we hear the other Senate bill coming up. Tyler, could you do that? And then we'll adjourn the meeting.
House Bill 708, State Board of Dental Examiners, dispositions and summary suspensions, time periods. This would require the Board of Dental Examiners to dispose of disciplinary matters within 90 days. If not, then the licensee concerned with it can submit a written notice. And then if the dental board does not make a decision within another 30 days after that notice, then the decision would be made in favor of the licensee being concerned in the disciplinary matter.
Okay, and then I'll just give Delegate Krebs 1 minute to sort of put this in context for us and tell us, or you can defer your time to anyone, just so we can keep in mind why we have this bill before us this year, since we do have another bill in a similar space. Go ahead, Delegate Krebs. Oh, you're on mute, Delegate Krebs.
Over the years, we've had some discussion about timelines for resolving decisions from the board and with regard to people that are under summary suspension and charges. And they say that they're timely, and we had a lot of discussion at the bill hearing about maybe it was the AG that was holding it up, maybe it was the board. And I don't really know who's right about this, but all I know is that there are practitioners out there for years that have been complaining that they're not getting their due process in a timely manner. And in the meantime, they're not able to work. So between now and next week, if the board, I don't know if there's time to do this, but I'd like to see the facts. You know, what are the cases? What are the outstanding cases? And what's we have some specific cases that have been outlined to us from very credible people of these timelines that have gone on for months and years. And I would like to ask you guys to present something to the opposite, to say, hey, no, we've done these things. Danielle very eloquently gave a couple of cases, and we have some more testimony that was written to us after the fact from someone else. And so having that information about how you handle these cases and how quickly they get resolved, and is it the AG that's tying it up, or is it the board, or is it that you only meet once or twice a month? I don't know. Real cases of people that are tied up and not being able to earn a living. So I think we have I always say, what's the problem we're trying to solve? We have a problem. The question is, where, in whose court is the problem, and how do we fix it? I don't know if it's this bill or not, but between now and next week, if you could come up with some of that information about some of these cases and where they're getting tied up. If it is the AG, we'll bring the AG in. If it's the board, we just like to know. And then we can figure out next week whether we need the bill, whether we need the study or whatever. But I think we have a problem that needs to be resolved to give these people due process. And it bothers me greatly. And Shirley Nathan Pulliam, Senator Nathan Pulliam, delegate, I'm sorry, she has passionately been calling us and bringing forth some of these issues, and it's been going on for a long time in their mind. So we need to get it resolved and have a timeline and have some certainty to people of when their cases will be heard. So if you can get us that information between now and next week to refute some of these things and tell us why, it would be helpful. And if anyone out there is listening, that, and Danielle, you might have some cases to say, you know, here's a situation, here's a situation. We've had a couple of them emailed to us because no one should be denied their right to due process by anyone. And so that's what our goal is. And if we can do something about that and have some information by next week, it would be helpful. And I don't know if Jerry or Haley have anything they want to add to that.
Well, before we go to them, I just want to hear from the board, from the dental board. Since we're going to be discussing this next week, can you guys be prepared with specific information on timelines and where the holdup might be if there are things being held up?
I would, Ed Morris here, please. I would basically say Delegate Cullison's goals are the goals that we aspire to as well. We want to get things adjudicated quickly and timely. There are a lot of logistical roadblocks, some legal. I'm not going to go into all the details, but I'll take this information back to the board and we'll see if we can expedite some information and try to answer your questions. Because I think our goals are all the same. I think it's a matter of getting that information to them.
Great.
And trying to solve the problem.
And if you have some legal
when would you like
roadblocks,
the information?
let us know what they are. If there are legal roadblocks, give us, you know, if we can help you to be better. And if you have these legal roadblocks, tell us so we can help.
Would you like this by Tuesday of next week?
That would be really helpful because we meet again on Thursday. So if the committee members have a chance to review it before then, that would be very helpful.
And I did submit written testimony as well when this bill was heard in committee on February 24.
Great, thank you.
You're welcome.
Did Haley or Jerry have anything to add based on Delegate Krebs' quick comment very quickly because we're 14 minutes late. We'll be 15 minutes late when you're done talking.
We know you're way over time and thank you. But if Danielle had one sentence to throw in, she's actually represented some of these cases that have gone on for years. Danielle, you want to just
help us be prepared for next week. Tell us what you're thinking about.
So I think Delegate Krebs's suggestion is an excellent suggestion. One of the things that we heard in the hearing before the full committee from Dr. Verma involved how the dental board does a great job of resolving these cases quickly, and she mentioned CRC conferences. What the subcommittee should know is that a CRC conference is a settlement conference. The real question here is, what cases does the dental board have to show timelines that aren't dentists who went into a settlement conference and came out with a settlement agreement, which is a consent order? The dentists that requested a show cause hearing, a full evidentiary hearing, when did their final order come out? And what I can tell you is from the things that Dr. Verma testified about this board sending things to the AG, unequivocally that does not happen. The board hears these cases themselves. They decide themselves if they are going to send something for an antitrust gut check to the OAH, and they often don't send them when they have an antitrust implication. They're the judge, jury, and executioner always. So I think, number one, keep in mind there's a difference between a CRC and the resolution and the timeline on that versus a show cause and a full evidentiary hearing. So I just wanted to make sure that you had that point in mind when you're gathering that information.
So, and specifically you're saying as we're looking at timelines, we need to be looking at the show cause evidentiary hearing case timelines, not the CRC timelines.
Yes, it's very important because the dental board has a fundamental lack of understanding of the purpose of a show cause hearing and what it's designed to do. And they also have, I've had well more than one case before the dental board where we've gone into a final, a full evidentiary hearing, and that final order does not come out in 60 days, 90 days, 120 days. So you're talking significant timelines.
Okay, and the last word on this subject will come from Dr. Grant, and then we will reconvene next week on the same topic. Thanks, everybody. Dr. Grant.
Thank you very much. And I would like to convey that I do not have a lack of understanding, and that the board has, not only do we have a board counsel who is from the who is an assistant attorney general who offers guidance to us all along the way. The board does refer cases to the office of the attorney general. So I'm just not certain where, I'm sorry, I don't know her last name. You refer to her as Danielle. I have not met her. So I would prefer to refer to her via her last name, but I don't know it. I'm not certain where she is getting this misinformation. I am knowledgeable. I would like to assure her that I do not undertake things without studying them thoroughly. And I look forward to providing the information you requested, hopefully by Tuesday of next week. Thank you.
And do you think it's possible, since it sounds like the board counsel is giving the board advice on this stuff, that the board counsel could join us for our discussion next week? I imagine committee members would benefit from that.
I will forward that request to him directly so that he is aware of the request from your committee. And thank you very much for hearing all of us today. We appreciate it.
Absolutely. Thank you. And thanks to all the stakeholders involved. Thank you to the members for staying 18 minutes over time. We will have full committee hearings at 1:30. So until then, goodbye. Thank you.